Welcome back at 7:20. All right, we've got the kinks worked out of the system. It is Breast Cancer Awareness Month, and we are teaming up with MedStar Health to bring you all the things that are important regarding this issue. And this morning, we're talking with Dr. Christopher Gallagher about treatment options. All right, can I hear you?
Yes, can you hear me now?
All right, I can. Absolutely perfect. Is it fair to say that now we have more treatment options than ever?
Oh, for certain. I think we divide breast cancer into a few subtypes, and for every type that we treat, we have many new things in the last few years, from newer immunotherapies to strategies for how long someone should remain on hormonal therapy to more targeted therapy. So, compared to a decade ago, we have many more treatments.
How important is it to make sure that you find a physician that is specialized in the type of treatment that perhaps you need?
Well, I think it's probably very important. I think first, sometimes women get better care for their breast cancer when they're in a cancer center where you have the surgeons and the medical oncologist and the radiation oncologist all working together, where you'll have access to genetic counseling, which can help women make certain decisions, plastic surgery, rehabilitation afterwards. So I think, finding a center that has people that specialize in breast cancer and all the multidisciplinary care is very important.
I think people are obviously they're familiar with having surgery. They're familiar with getting chemo or radiation, but everybody might not understand the hormone therapy that is out there or the proton therapy that is out there. Can you talk a little bit about those options?
Yeah, the most common type of breast cancer expresses markers for estrogen and progesterone, and medications that sort of target that can help literally prevent it from coming back for the most part. And proton therapy, a newer type of radiation, is still sort of emerging as for what its role is. But its advantage may be that it can target a smaller area and have sort of less collateral damage and treat with a little more precision. That's sort of yet to be known.
In terms of surgery, obviously that is a big step and a big decision for a woman. Do they have better processes, I should say, in line now to kind of help women and their families deal with all that means, not just physically, but psychologically, emotionally, socially?
Yeah, I think having some mental health support, engaging, family and friends is certainly obviously important, but having, even just a nurse navigator who's someone who sort of serves as that concierge or that touch point to help women get to the right place at the right time, and hopefully understand sort of each step in the treatment, sort of the glue of the whole care team to help a woman from the beginning to the end of her treatment.
How critical is it, and I will say this every time we do a series on this, but how critical is it really for women to get mammograms and for it to be caught early?
Yeah, it's vitally important. We have better treatments for early stage disease, so early detection is probably what's most important. What has changed? It was not that many years ago, women between ages 40 and 50 were recommended to have mammogram, and then the recommendation changed, but the guidelines have changed back to having women between 40 and 50 have their mammograms, partly because we have better treatments and we have better detection. Mammography has improved, ultrasound as a sort of a companion imaging study, and the strategic use of MRI. We're doing a better job of finding breast cancers early.
We've come so far, but where would you like to see treatments still go?
Well, I think the ultimate goal is to get is even women who are diagnosed early to get to 100% cure, and those women who have more advanced disease to potentially be able to cure them and live a normal life, cancer-free. That's sort of the ultimate goal.
Absolutely. Dr. Christopher Gallagher, thank you so much for your time and your insight this morning. We really appreciate it. You all are doing everything you can do now. We have to do what we need to do, which means get those mammograms. There's the information for MedStar Health. If you have any questions at all, you certainly can reach out to them. Thank you, sir. All right, 7:25.